I've devised a 9-phase program to make sure that we get you the best results possible. Phase 1 of my biohacking program involves full body analysis. This revolves around getting a complete blood work of your inflammatory numbers, your hormone paneling, 150 different touch points in your medical care. After we get a full body analysis with biometrics, body fat composition, as well as all the metrics necessary for health optimization, including diabetes check, blood pressures, and insulin resistance scores, we move on to phase 2, which is optional. We put you on a continuous glucose monitor. This is an FDA-approved technology that a lot of people are utilizing. You might have seen people wearing one. This is a device, it's about the size of a coin that goes in the back of your arm, and it gives you a real-time data analysis of your blood sugars. What's interesting about it is that if you're wearing one of these, you can actually keep track of your blood sugars in real time. Meaning that if you eat a bowl of pasta, you can see how high your glucose has gone up. Having high sugar levels can put you at risk of diabetes, heart disease, and strokes, as well as other chronic conditions. It's important to get data. So this is why you would wear one of these. You could wear it for 2 weeks, or you can wear it non-stop for up to a year. Usually replaced every 2 weeks or so. Phase 3 is another optional metric that we run, is something called remote patient monitoring. Wouldn't it be great if you could connect with your doctor at all times with your biometrics? That's the beauty of remote patient monitoring. These are devices that are shipped to your house and use Bluetooth to upload your data through the cloud to my system, so that I can actually keep track of you in real time, including blood pressure, weight, and other important metrics that you might be able to want to share with me. Phase 4 involves treatment. So one of the devices I have here in the office is something called Emsculpt Neo. This gives you 20,000 ab compressions in 30 minutes. These are devices that are geared for people that don't have time to necessarily do a ton of ab workout in the gym, but want to get great functional results. The other benefit of the Emsculpt Neo is that it has an RF laser which burns off fat. So if you're looking to build muscle and burn fat at the same time and don't have a lot of time to waste in the gym, this might be the right device for you. What I've also noticed is that people, especially during COVID, survived better if their nutritional status is optimized. People with obesity are usually actually malnourished because they usually eat the wrong things. So when people are losing weight and when they're looking for health optimization, I give them IV vitamins as well as NAD. These are optimizing technologies. What we're trying to get here is the best performance possible in terms of energy, immune function, and performance. A couple of things that I've tried to use recently are oral vitamins. These are FDA-approved vitamins. So sometimes when you look at a nutritional label, you would see not FDA-approved to treat or cure any disease. I try to go around that by giving you things that have been vetted by me, as well as are the best possible supplement available on the market. We also do rejuvenation here in the clinic. This is Miami after all, and looking your best sometimes makes you feel your best. So getting around the Botox or fillers in the right places can make you feel rejuvenated, healthy, and vital. Now for the skinny shots. The GLP-1s are FDA approved for weight loss, as well as cardiovascular risk reduction and sleep apnea. If you're suffering from obesity, this is a great medication to try. A once-a-week injection, which gives you 10 to 30% weight reduction over a course of time. If you're looking for a physician to prescribe these to you, as well as administer them to you, and monitor your metrics while you're on these medications, then come to my clinic, I'll take care of you. Some people order this stuff online, you don't know what you're getting, and nobody's really monitoring you. Keeping track of your metrics is the optimal way to do these medications, as well as titrating the dose to the right one that's right for you. Typically, I start people off on their lowest dose if they've never tried it before, and slowly increase the dose at their tolerable level, meaning that if you start experiencing side effects, then we slow it down, maybe even reduce your dose. If you do experience side effects, then we try to optimize you by giving you other medications to counteract the nausea and constipation you might be experiencing with these shots. The next phase is more analysis. So one thing that we try to do here is give you a full picture of your body. Echocardiograms, carotid ultrasounds, thyroid, and lower extremity duplexes gives you a full view of your body. One important thing that we're doing here is also liver ultrasound. People that suffer from alcoholism, from obesity, and from high stress can develop liver issues. One of the most commonly underdiagnosed conditions is called NASH, N-A-S-H, or non-alcoholic steatohepatitis, fatty liver from metabolic issues. Having this condition go untreated can result in severe debility, including portal hypertension, varicosities, fatigue, poor metabolism, and of course, liver failure, cirrhosis, requiring liver transplant. Early detection is optimal. We do blood work as well as liver ultrasounds to catch it early and address the underlying condition, which is usually obesity. Try to get your best results. One important technology we use here in the office is stress testing. So you come in here, we give you an injection and do a nuclear stress test to gauge how good the blood flow is to the heart. To optimize your survival, we try to reduce your chance of having a heart attack. An early detection of poor blood flow to the heart is great. Doing early detection on your heart and catching diseases at their earliest stages is of vital importance to make sure you have a long, healthy life. Finally, we do early cancer detection, including biomarkers as well as a new test called the Gallery test, which tracks 40 different cancers inside your bloodstream. Stage 1 or even stage 0. Early detection is vital for survival. That's why having the right person to take care of you is such important. For further consultation with me, please feel free to click the link below or call the office number and make an appointment with me. Happy to help.